Well, hello. Welcome to Sunday Morning Coffee with Dr. Childress. Um, so today I want to be discussing the collapse of mental health in the family courts. And I also want to try to hold this down to about half an hour. So I'm gonna try to keep myself from talking quite so much about all this stuff. Early on, I had to give more information. Once I get all the information out, then hopefully I can shorten these little talks down a little bit. So, the issue that parents are facing, and I want to talk with the parents today about what's going on for you. The issue that you're facing is that there's a complete collapse of the mental health system in the family courts, and that's anticipated. It's what's supposed to happen. What the problem is, what the pathology is it's a systemic problem. The mental health system has failed. The courts has failed. The parents has failed your children. Back in the 1980s, this pathology is very dangerous, and I can explain how it manipulated the situation by making itself very dangerous. But essentially, the pathology drove away the clinical psychologists, the treatment psychologists, and instead, because it's professionally dangerous to us, and instead it gave you your own special psychologists called forensic psychologists. And they're the worst imaginable. They don't diagnose, they don't treat, they do something different. And it's been a failed experiment. Professional psychology did an experiment on you of giving you your own special psychologists who didn't diagnose or treat anything, and it is an abject failure. And so that needs to stop, and we need to get you back into clinical psychology. But the problem with systems, and I know how to do this. I have a master's degree in how to change systems and community psychology, it's called, dealing with pathology by changing community systems. So I know how to do this. And the issue is that the dysfunctional system is stable with the symptom present. Okay, so the symptom, and in this case, the symptom is the ignorance and incompetence of the mental health people, because they're the ones who should be protecting your children. And the reason, and the fact that they're not protecting your children and you from spousal abuse using the child as a weapon creates all the problems. Then you have to prove to a court now what a pathology is because your mental health person is failing. You go through years of nonsense, and because the mental health person is failing to give you the diagnosis of child psychological abuse, to tell the court this is child psychological abuse. And that's the only thing that's a problem, is the mental health people. They're failing you. The reason they're failing is because they're ignorant like a rock. They're violating 2.04. They're not applying any knowledge. They don't know any knowledge. Violation 2.01. They don't care. They're lazy. And so they're lazy, unethical, incompetent, and it's malpractice, failing in their duty to protect. But that's the system. And as long as all the forensic psychologists did the same thing and were equally stupid, then it's a dysfunctional system with the stupidity of the mental health people stabilizing it. So the first thing we have to do, because if we try to take the symptom out, the ignorance of the mental health people, every single aspect of the system will work to keep that symptom present, because it needs the symptom to stabilize the dysfunctional system. The moment we take the symptom out, the whole system's going to collapse. And that's what's happening. The reason it's collapsing, and this is why I talked to you before and I'm educating you about what the situation is around you. The reason it's collapsing is because the forensic psychologists got over here, and it drew the worst of us, of the clinical psychologists, because it's dangerous to work here and it's not treatable. Narcissistic borderline dark personality pathology, it's very dangerous. It's non-responsive to treatment, and they didn't know what to do. And the ones that came over here were simply in it for the money. Okay, and so they would take your money, 20 to $40,000 for this big puffy forensic evaluation that they keep growing and stuff, and they get to be this pompous expert in the family courts deciding who gets to be a parent. And they just got caught up in their narcissism and their ignorance and started making up new pathology, parental alienation. Now it's resist, refuse dynamic. They just make stuff up because they think they can. No, you apply knowledge first. Then, if it doesn't solve it, then you can start making stuff up. But you don't start by making stuff up, you start by applying knowledge. The problem is they don't know the knowledge. And so people who know the knowledge, Bessel, van der Kolk, Ed Tronick, they don't work in the family courts. No one works in the family courts, and that's the second half. So we isolated you to your own special psychologists who are the worst imaginable, and then the clinical psychologists have abandoned you. So all the clinical psychologists who work with ADHD, autism, personality disorders, eating disorders, substance abuse, everything else don't work in the family courts. So if you try to get them back to the family courts, they're not competent because they haven't worked in with this pathology. So even the closest we have, let's say the DBT therapist for borderline, they don't know how to fix the parent-child relationship. They're working on the borderline directly, and their DBT is for that, is for the borderline parent, not for the effects on the child. Or you take somebody like Sue Johnson, who comes up with emotionally focused therapy, wonderful attachment based therapy, working with Ed Tronick. She does it for couples. She's not doing it for the parent child relationship in the family courts. No expertise works in the family courts from clinical psychology. So been hit with a double whammy right now. So the moment we take out the ignorance, the forensic psychologists collapse. So there's no them anymore. And you can look at the New York Blue Ribbon Commission on Forensic Child Custody Evaluations, slammed them and said, in 11 to 9 votes, said, we need to stop forensic psychology in the family courts. Yes, we do. Absolutely. Absolutely. It solves nothing. It exploits parents. It's just awful. Awful, awful, awful. Forensic psychologists, which means all the forensic psychologists know now, are currently out there, are incompetent, they're unethical, they're lazy, and that's all of them. So pick one in the AFCC. Pick whoever forensic custody evaluator, they're Vita, they've been doing this for 5, 10, 15, 20 years. They are unethical, malpractice for 20 years, misdiagnosed the pathology for 20 years. They are the lowest of the form of anybody. They've been colluding with child abuse for 20 years because of their ignorance and incompetence. So the forensic psychology as a whole group is a real problem. But what do you got? What's your alternative? Nothing. Nothing. Because this clinical psychologist won't work here. I was one of them, the clinical psychologist who didn't work in the family courts. Look at my Vita. I didn't come over here till I'm an old guy after working with ADHD, autism, everything else but you. I came to work with you. You were the last two, geriatrics and family courts. I know what geriatrics is. No, people don't want to work geriatrics. That's incredibly depressing. I went out and checked it out because it's incredibly depressing. And oh my goodness, I wanted to see what's there. And I came over to the family courts to see what's here. Holy cow, there's active child abuse and active spousal abuse in the family courts. That's my pathology. Transgenerational transmission of trauma, child abuse. These children are being abused. There's parents are being abused, horribly abused. Having your kids taken from you. Oh my goodness, that's devastating. So I stayed. I stayed to solve it because I'm a clinical psychologist. I have duty to protect obligations. I'm the only one over here. Okay. So there's no clinical psychologist in the family courts because it's too dangerous. and they have the right to say that. They should not have to put their license on the line to try to help your family. No, that shouldn't happen. But this is the abuse pathology. And that's one of the things I'm exposing over here. I come over here as a clinical psychologist and I have to deal with all this abuse. And that because it's an abuse pathology and it's in the family courts, which means you have a whole litigation thing and a opposing counsel who's trying in every way possible to discredit my testimony, which means abuse, slander, everything, and then flying monkeys around, and the pathology itself is delusional, persecutory delusion, is psychotic. It believes it's being malevolently treated by you, and it's very vengeful and retaliatory. Now, these psychologists, the clinical psychologists, the good ones, worked hard for many, many years in their education. They got an internship, year of supervised internship, then a year of supervised postdoc, and then sit for the licensing exam. And you want them to put all of their life at risk? No, 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 no. They'll go work autism or ADHD where they want them. Okay, so you won't get them over here. You'll go out to the psychologist and say, I have a family problem and it's in the courts. And they'll say, I don't work with the courts. You need to go to forensic psychology. You say, but they're awful. And they say, oh, that's life. So that's what's going to happen right now. So, been moving this forward for a number of years now. I work ahead. I know what's coming. It's called foresight. You should try it sometime. Um, and so I know what was coming. Here it comes. Once we collapse, the Gardner PAS people are just a fringe group of professionals. That's dying off. We have, for the Gardner people, we have the media coming, ProPublica and bashing Gottlieb, and Gottlieb is a nightmare. Oh my God, her program is awful. Once that gets exposed, they go down. Harmon's going to go down with her. And the whole thing of parental alienation is they are a fringe group of professionals who disregard the diagnostic guidance of the American Psychiatric Association and the ethical guidance of the American Psychological Association. They think they know more than the APA, American Psychiatric Association, about what pathology is and the diagnosis. APA said, no, there's no such thing as parental alienation. They say, yeah, we're just going to ignore them. And because we're smarter than the American Psycho, we're going to continue with this parental alienation stuff. They are a low, low level of professional. The only thing they're an expert in is stuff they can make up. Here's professional. Okay, here's professional. We start by applying the knowledge. All the knowledge, we apply the knowledge first, standard 2.04. Then and only then, if it's not enough to solve the pathology, then we can go and add new stuff or propose new stuff. Then after. So Burnett and Baker and Harmon and all of them, Lorandos, all of them have an obligation, ethical obligation, mandatory ethical obligation to first apply the established knowledge, first apply family systems, first apply attachment, first apply personality disorder pathology, first apply complex trauma and child development. Do that first. But they don't, because they're unethical. They think they're exempt from ethical standards of practice. Now, if you look at them, they're like a ragtag bunch of misfit toys. You have Burnett, who's a psychiatrist who's retired. Okay, so he's been working 40 years. Here's the thing. If this is a shared persecutory delusion, which it is, then Bill Burnett misdiagnosed it for his entire career, and he's still misdiagnosing it. He's still not talking about it being a shared persecutory delusion, and he's a psychiatrist. That's his book, the APA, the DSM-5. That's a psychiatrist's book, And so that's what really irritates him about me is I'm a psychologist and I came over here and I diagnosed the pathology and he didn't. Oh my goodness. So he has to prevent everybody from listening to Dr. Childress. He doesn't want anybody to know about Dr. Childress because it exposes the fact that he's a very bad diagnostician, very bad, and was, potentially colluding with the child abuse or, by creating this low level um, diagnostic entity, this parental alienation system. He kept these people, these low level professionals, kept everybody in chaos and argument and fighting for 40 years rather than diagnose what the pathology is, the rigor of that. And they're just bad professionals. And I expose that. And so that's a problem. That's why they don't like me. But the truth is the truth, and it will be exposed, and they will be exposed for not being experts in anything except their own fantasies, and for being very problematic level professionals. That's why I call them a fringe group of professionals. Um, and so they're kind of headed out. The domain. They got the whole UN saying it's not acceptable. Parental alienation. The UN says it's not. You got the Cadence law is saying it's not. You've got Dr. Childress saying it's not. So they're going to be in trouble. Then you have the forensic psychologists who are being exposed for their exploitation and incompetence and ignorance. And it's just phenomenal the level of ignorance. So I'm doing what I'm doing. I was going through line by line now on their custody evaluations, kind of reorienting, applying knowledge to the data they report because they didn't apply any, and it's a bad situation out there until it changes. But what's going to happen though is that the family courts are going to have no mental health people. The forensic psychologists are worthless, but they're going to run away. They're going to flee from the family courts because it's going to get too dangerous over here. Because they're going to be required to fix things and they don't know how and they don't know how to diagnose everything. So they're going to disappear. Plus, things like the New York Blue Ribbon Commission that says no more forensic psychologists. Plus, the fact of supply and demand that parents are going to be wanting diagnoses and treatment, not custody evaluations that solve nothing. So supply and demand is going to dry up the field. So what's going to happen to the AFCC? You have this professional organization, half attorneys and half mental health people, and the mental health people are now gone. The New York says it's awful, what they do is awful, and we're going to ban it. Well, that's what should happen. And Dr. Childress is pounding them on each one, going through line by line, exposing their ignorance and their unethical practice, line by line. It's going to become too dangerous. They're going to flee. So you're not going to have forensic psychology, and the clinical psychologists won't work here. So how many psychologists will you have in the family courts? Zero. How many you go to treatment? What do you? Zero. You're not going to have anybody over here. I don't know what to tell you about that. And parents will ask, do you know something? No, I don't know. Is there something? No, there's nothing you can do. There's nothing you can do because the systems are broken. They've always been broken. Okay, they've always been broken. Ask any family who's come through the system prior to you. They destroyed their life, destroyed their children. The system has always been broken. It's been a hidden broken rather than an overt broken. Now we're going to overtly break everything, which is exactly where we need to be, because we need to expose the system. That way we can get rid of the ignorance and incompetence, and we can layer in knowledge, and we can fix the systems. Pilot program for the family courts. Just listen to Dr. Childress. I can tell you how to do it. But everybody fights around me. Okay, so do a pilot program for the family courts. Okay, but fix it. Let's start moving towards solutions here This is child abuse. This is spousal abuse. We need to diagnose it. We need to protect the child. We need to protect the spouse. So for parents, what do you do? There's three groups of you. And I'll cover maybe this over the course of time and some more of these coffees. But there's three groups of you. There's the new entry parents. These are parents who've had a divorce probably within the last 2 years. And so this is starting to catch hold. You haven't had a huge amount of problems yet in the family courts, with years of failed reunification therapy and that kind of thing. So you're just getting off the ground. You didn't expect this. You thought you were just getting a divorce. This is really weird to see the child's symptoms, and you're trying to orient to what they are, what's going on. So you probably Google the internet, you find parental alienation, you're finding your way through things. Do not use parental alienation. That's a dying term. It'll just get you locked up. It solves nothing. Stay in established knowledge, because that will require your professionals to also use established knowledge. And so stay grounded, and because then you can also hold them accountable. And that's the critical issue. We need to hold them accountable for protecting your children. It's their job to protect your children and protect you. And so we need to be able to hold them accountable. I cannot hold them accountable to PAS or parental alienation. I can hold them accountable to shared persecutory delusions, cross-generational coalition, and child psychological abuse in the DSM-5. So a factitious disorder imposed on another. I can hold them accountable to all real things. We can hold them accountable and get them to do the right thing. So you're just orienting, and you're coming in, and hopefully you found me. Hopefully you found this. And what do you do as now when you don't have a mental health person? Okay. The second group is the current people. That's your middle group. And you're, after probably 2 years, you may have had a custody evaluation, you may have had some reunification therapy that didn't work, and you've had a number of court litigation things. The pathology may be spreading from the oldest child to the younger children. In the early parents, the oldest child is likely infected, affected. But the younger ones may be currently spared as things start. In the middle zone, the younger children start to get pulled into the pathology as well. And so what do you do? Okay, that in this middle group to solve the situation. And then we have the now adult children of alienation. You've gone through the process, your child is aged out, they're above 18, and you still have the emotional cutoff in your relationship with the child, or the now adult child. So what do you do? So there's three categories, and then the parents in different categories will have different things they'll be trying to do. So let's start with the recent entry parents. First, most important thing is stay out of the family courts. Okay, you need to get this over to treatment. You need to define this. You need to control the narrative and define this as a treatment pathology, a treatment issue. This is an attachment pathology, a problem in love and bonding. You need it fixed. That's all you need to do as a layperson consumer. I have an attachment pathology. I need it fixed. It's up to the doctors to figure out how to fix it. Now, parents should never, ever, 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 patients should never have to explain a pathology to a doctor. You do. That indicates just how bad things are in the family courts, that the patients are having to explain the pathology to the doctors. Wow, that's bad. But you do. So, in future coffees, we'll talk about maybe how to explain it to ignorant doctors. But that's the situation. You're going to have to learn what this pathology is, but don't take it on as your responsibility. It's their responsibility to protect your child. And it's easy peasy. It's called a diagnosis of child psychological abuse. And they can give that if they want. They're licensed. They're authorized by the state to diagnose pathology. to identify what the problem is. And if there's child abuse, they have an obligation to say there's child abuse or get an assessment. Physical, sexual neglect, it goes over to CPS. Psychological abuse isn't mandated, though. They have an obligation to assess it and identify it, diagnose it when it's there. Diagnosis means identify, pathology means problem, treatment means fix it. You can use all those words interchangeably. They have an obligation to identify child abuse when child abuse is present, diagnose child abuse when child abuse is present, and to give you that diagnosis so that you can then, as a parent for the child, protect your child from the child abuse. That's their obligation as doctors. So it's not your obligation. But if they fail, you still got your child. What are you going to do? So you have to um, hold them accountable and explain the pathology. You need to get that diagnosis, child abuse. So get it over there. I have a mental health consultation page on my consulting website that's written for them. So you can refer your mental health people to that page, and it will be a doctor talking to a doctor rather than you trying to explain it. Also, on the attorney resource page, I have a handout that describes the pathology. So you can say, this is what we're worried about: shared persecutory delusion and false attachment pathology. Child psychological abuse, though, is the diagnosis we need to land on. Now, I use the shared delusion and factitious disorder as the standard for what makes child psychological abuse, but they can use whatever they want, whatever standard they want. They just need to return the child abuse diagnosis, just so that you have what you need to be able to protect your child. And the spousal abuse diagnosis, using the child as a weapon. There's two dangerous pathologies here. So the pathology wants to drive this into the courts to put you on trial for being a bad spouse, bad parent. And so, and to make it hard as possible for you to see your kids, to destabilize you and to bash you and put you on the defensive. Don't let it do that. This is not a custody issue. This is a child protection issue. This is a treatment issue. We need to get it over to treatment and fix it. So we'll talk about that coming up. So, yeah, get this into the healthcare system. Well, Your Honor, this isn't about custody. We need a treatment plan. Just hold on to that. You need a treatment plan for that. You'll need a diagnosis. Treatment for cancer is different than the treatment for diabetes. So you'll need a diagnosis. The diagnosis is child abuse. Then we know what to do for treatment. Don't rush into treatment before you identify what the problem is, because the problem is child abuse. No therapy will be effective for child abuse if we don't first protect the child. If I'm sending the child home to be sexually abused by her dad or stepdad, there's no therapy that's going to be effective as long as that child's being abused. That's just a fact. We first protect the child. That's why diagnosis in this situation is critical. That's why there's been 40 years of failure. Now, for middle folks, if there's a treatment failure, and you've probably been through treatment failure for the middle group, there's only two possible explanations, only two. Either it's a misdiagnosis, you're treating cancer with insulin and the patient didn't respond because you've misdiagnosed the cancer, or two, you're incompetent in the delivery of the intervention for that diagnosis. Because if you've accurately diagnosed the pathology and you're competent in the delivery of the intervention, then you're going to solve it. That's going to fix it. So if there's failed therapy, and I put failed therapy for attachment problems as between 3 to 6 months. Okay. If you've gone through 3 to 6 months and you haven't fixed it, then it's either a misdiagnosis or you're incompetent. Pick one. And most people will say, I'm not incompetent, so therefore I must misdiagnose it. Yes, you did. You're failing to misdiagnose the child abuse, and nothing's going to work as long as the child is being abused. And so that's the fundamental issue. They are rampantly, wholesale, missing the diagnosis because they are incompetent in the assessment of delusional thought disorders. They shouldn't be working here at Standard 2.01. But they are, and as a result, they're destroying the lives of children, destroying the lives of parents, and nobody's stopping them, and it's just a mess. So for your middle group, you may be getting a hold of me regarding the mental health reports, seeking a second opinion consultation on these things to recorrect the situation. That's unfortunate. It's like a surcharge onto the mental health people. If your mental health people would diagnose the child abuse, you wouldn't need me. You put me out of a job. Okay. Yay. Good. I'll go early childhood. I'll go somewhere else. Okay. I don't need to be in the family courts protecting children from child abuse. Please, somebody, mental health people, start protecting the children, and then I can stop doing this. But until they do, I'm kind of the second opinion review, and that's the appellate system in family courts for a disputed diagnosis is second opinion. And so that's my current status, sort of, is my personal clients or my clients in my professional consulting practice are court involved, and the attorneys bringing me in. For the now adult children, and I'm realizing I'm at about the half hour point, so I'm going to wrap up. For the now adult children, we'll be getting to those. I'll be getting to those ultimately, hopefully. But the person who is there now is Dorsey Pruder, family coach and businesswoman. For the now adult children, she's the only one that has a program called Reunited for the now adult children. It's an extension of her parenting course, Higher Purpose Parenting, same philosophy, same attitude. So I'd get over to her and her people at any phase, the early folks as well, the Higher Purpose Parenting course, and think about coaching support out of her. Um, the end phase, you want higher purpose parenting maybe for the younger kids, and maybe into Reunited course for the older ones. Then she has a couple of high end programs, kind of expensive. High Road 4-day workshop, fixes everything, needs a protective separation, needs that child abuse diagnosis. It is effective, the but it's also expensive. And then she has a custody resolution method where she tags all the data. If you've got mountains of data, like you're in the middle phase and you're trying to prove to the court to get that protective separation period, then she hires data taggers to go through all your data and identify various symptom features. It's called coding. It's a qualitative research method. Also very expensive. Hiring the data coders and doing all that and developing the software program for it and everything. Now, I don't want to hear about how expensive she is, because she deserves everything she earns. Okay, it's tough over here, and everything she does is effective, as opposed to the forensic psychologist. My analogy is, if you ask a contractor to build you a patio, and they take your money to build you a patio but never build you a patio, that's called fraud. Okay, in my book, that's called fraud. And then when they do it to other people as well, they just go around taking everybody's money and doesn't give them a patio. That's fraud. The psychologist going out there taking everybody's money and not fixing anything, I consider that fraud. Okay, that's our job, and we have treatment plans, goals, interventions, time frames, and outcome measures. Outcome measures, I'll talk about those. Those are really wonderful. Outcome measures, and accurate diagnosis, and that's the problem right now. They're not making an accurate diagnosis. So, yeah, for as far as my attitude with Dorsey, and if anybody says, "Oh, she's expensive," yeah, and on her higher end stuff, yes. And my opinion is that we should all get a GoFundMe and chip in to buy her home in the Hamptons, okay? Because she deserves it. She's over here, she's fixing the pathology, very dangerous. She is the most experienced professional in the family courts of fixing the pathology. So, yeah, let's get her a GoFundMe and get her home in the Hamptons, and then she can lower her costs. Or we can get a pilot program for the family courts, get Dorsey to assist with that and her input on that, and then transfer the High Road protocol into the research and healthcare system. Let them do whatever wants, and she holds trademark on High Road and stays the queen goddess of everything fixing the pathology. And if we start diagnosing the pathology, then custody resolution method isn't needed anymore because we have a diagnosis of the pathology right away. And we don't need to prove it, and it doesn't go on for 5 years, and we catch it early intervention. Yay. So there's other ways with that, but she's going to be your resource on the old side. She's a resource available to you as you enter things going forward. If you need a second opinion as a consult, I'm here. I hold monthly consults, general public, first week of every month, with scheduling through my consulting website. And I'm not licensed in your state, so there's only a little bit I can do. But basically, I tell you what I tell you right here, right now. You need to get it onto a treatment path. You need to do these things. The in the middle group, if you're thinking about coming to get me or coming to work with me, you second opinion. What I do is I read reports from other mental health people, and I apply the established knowledge of clinical psychology to the information I read, which is what they didn't do. And because there's an attorney in the matter who believes that the application of knowledge from clinical psychology will assist the court in making its decisions around child custody. So if you kind of already know that, and so go to my consulting website, take a look at everything, but go over to the attorney section, read all the handouts, risk assessment handout, pathology description handout, my expertise handout, and stuff. Talk with your attorney about it. If your attorney thinks my input might be helpful, then on that first of the month consult thing, you and your attorney can just meet with me at one time. That's fine. I can talk to all your professionals. I just can't talk with you so much because I'm not licensed in your state. So, but that you don't. Sometimes I talk with a parent, and then by the end of that, I say, you may want to talk with your attorney, and if your attorney thinks it's helpful, come back. So we double bounce it. But if you kind of know ahead of time, you can just, or your attorney does, you can just move directly into that. So I'm kind of to help move things in the proper direction or get them going in the proper direction. So I'm going to try to wrap up real quick right now and defer what I'm going to talk about next over to a next coffee, which is, what do you do as an early or middle person when you have no mental health system over here? Well, for what I'm recommending for dads, go over to the dialectic behavior therapists. They're the ones who work with borderline personality disorder. We're going to have to get them and recruit them back to the family courts. They won't want to come. We'll talk about that, but we can get them back. They're the trauma psychologists. They work borderline personality. They're not afraid. Just frame it up. This isn't about custody. No, this isn't about custody. This is about treatment, and we need the diagnosis on this because we have the collapse of a borderline into persecutory delusions. The DBT therapist will recognize the borderline symptoms, and for dads, that's what you're dealing with, a borderline version of this. For the moms, you're dealing with the narcissist dad. Now, that has a higher spousal abuse feel to it. So get over to the IPV spousal abuse, intimate partner violence, domestic violence, spousal abuse therapist. Call up a hotline. Find a good one, not a monkey. Find a real, honest to goodness spousal abuse therapist. Bring them information to them. They'll recognize it. Yep, using the child as a weapon, narcissistic dark triad. Yep, they got it. And they'll understand. They're also, because they're working a dangerous pathology, spousal abuse, they're into that protection zone. So they'll step up, hopefully, to make the diagnosis and protect your child. So as the system collapses, where do you go to find the clinical people? We're building the airplane as we fly it. Hopefully it doesn't crash. So you're going to, the dads go out, you find a DBT therapist. They have established knowledge we can apply. And moms go find the domestic violence, IPV therapists, and we'll bring them back into the family courts. It's kind of like Flight of the Phoenix, if you ever seen that movie where they, you know, Jimmy Stewart builds a plane in the middle of the desert to help them escape. We're building the plane in the middle of the desert so we can escape the family courts and get back to civilization. Once this gets solved, once anybody is motivated to solve it, that's all it takes is motivation to solve it. It's not motivation in forensic psychology. They have no motivation. No motivation in the Gardnerian PAS people because they're an expert, and as soon as PAS disappears, they're no longer an expert. Poof. So there's no motivation for them to solve it. There's no motivation in forensic psychology, and there's no motivation in clinical psychologists because we've just abandoned you and tossed you off into, a camp in the woods where nobody hears you scream. So once this gets into the world, once this Cadence Law and the legislatures and people start paying attention, the media comes over here and starts paying attention to the nightmare in the family courts and what's been going on and the unethical practice, turn over the rock and see all the creepy crawly things starting to run around. Once that happens, the system collapses and there's going to be protests from the judges, from parents, from everybody. I cannot get therapy in the family courts. What's going on? The APA is going to have to come in, step in, and figure this out. And at that point in time, tag them. Where were you for the last 10 years? You've abandoned these. You were colluding with the child abuse by covering up for the unethical practice in forensic psychology. And they were covering up for it. 2018, petition to the APA. Where did that petition go? Pull the string. Media. When media comes over here, I've got a website. Pull the string. Where did the petition for the 2018 signed by 20,000 parents, what did the APA do with that? Who did they give it to? Pull that string. They were covering up for the unethical practice that they've known about for 5 years. The APA has known there's been rampant, unchecked ethical violations in forensic psychology for 5 years, and they did nothing. Each one of those psychologists has obligations under standard 1.04 and 1.05. When they learn about unethical practice, you're not allowed to do nothing. They did nothing. The APA is unethical. They're colluding with child abuse as a result of their cover up for the forensic psychologists. Oh my God, it's a mess over here. That's okay. Hang with me. Diagnosis guides treatment. It gets really simple. Clinical psychology is coming back. We need to make it safe for them. That's why I'm over here. Look at me, old guy, senior staff. If not me, who I can be safe, hopefully, in this crazy, dangerous world of the family courts. I've made it to the point safely where I'm now in the courts testifying as an expert witness. So now that gives all the other clinical psychologists a path to stay safe in the family courts. Don't get into custody. It's about diagnosis and treatment. Stay focused with what you do with your role as a doctor. You diagnose and treat pathology. Diagnosis needs to be accurate, and the diagnosis here is the child's psychological abuse and the spousal psychological abuse using the child as a weapon. The mental health people need to stand up and start making those diagnoses and start protecting people as their obligations require. So with that, I'm going to head off to my Sunday, and we'll see you next Sunday, and maybe I'll talk about the DBT and the IPV therapists and how to work with them. All right. So take care, everybody. Bye-bye.